Thank you for joining us. You are a part of an elite group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For 38 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
Hello, I am Egypt Sherrod. I wish you love and light. I thank you so much for joining us for a very important, vital conversation. I mean, this conversation that we're going to have tonight can literally save a life. So celebrating 38 years for Black Women's Health Imperative. Yes, 38 years. Tonight, we're having a conversation about Black mortality rates, maternal health. Black mothers matter. And our sponsor is Huggies. We want to thank them so much. Huggies and their Helping Hugs program provide communities to support to mothers who face greater vulnerability. So thank you so much for seeing the importance in this conversation and initiatives like this. So before we get into and really dive into what is plaguing our community right now, I want to tell you why I was so honored to be invited to host this tonight, because I am 43 years old. Ask me that again in public, I might say 34, but I am. And I found out by surprise that I was pregnant as I was climbing the Atlas Mountains in Morocco, and I was, 42. I found out, oh my God, I'm pregnant with a surprise baby. It was an amazing experience to find out, but I knew already that I was going to experience what they call an at-risk, a geriatric pregnancy. And so I was very astute to take all of my prenatal vites, to do yoga, to work out, make all my doctor appointments, ask questions, eat healthy, do all the right things that I didn't necessarily know to do in my first pregnancy when I was in my 30s. So I had a beautiful, barely any morning sickness, barely any issues until I got into my 7th month, where I was diagnosed with gestational diabetes. And again, I just simply could not understand why. I was doing all the right things, eating healthy, but this was something in my head. I convinced myself, I'm just going to manage. This is still going to be beautiful. I'm almost there. I'm in the home stretch. I do my little prick, continue to eat right, manage my blood sugar, and I actually made it. Water broke, went into labor, and I had to have a C-section, which, that wasn't new to me. I'd had one previously. Everything, and I'm really going to go through this with you because it's almost I didn't think it could happen to me moment. We've been hearing all of these statistics. This is not new stuff about how Black women were dying at significantly higher rates during childbirth than white women. I think they were saying 3 to 4, but if you were over 30, according to the CDC, it was 4 to 6 times more likely to experience an issue or death during childbirth. But again, I'm thinking, I'm me. I'm doing all the right things. It could not happen to me. Well, right as I was going into labor, something just didn't feel right. It was almost an out-of-body experience and the doctor was saying, you're having an anxiety attack. We just got to calm you. It's going to be fine. They gave me the epidural. I laid back, and I literally had an out-of-body experience where I felt that I was floating above my body. To this day, I'll tell my husband, I felt like I died on the table. They said that it took a very long time. They were very aware. It took a long time to bring me out of the anesthesia afterward. I mean, my mother, my husband, everyone was sitting there like praying because it was taking so long. I simply would not wake up. They would not give me more information than that, except a day and a half after I delivered Harper, is my daughter, who's now 18 months. A a day and a half after, I was being discharged from the hospital after a C-section, major surgery that had some complications. I also had my tubes tied during that time. So there was, a lot going on. Well, my mother, who was my advocate, because I simply was so weak, it didn't feel right. I don't know if you understand what I'm saying when I share with you that we know our bodies and when something's just not right, but I was so weak, I couldn't explain it. So my mother's saying, she's not leaving this hospital. Y'all can't let her leave. My doctor, the nurses, the administrator, everyone said, we're going to have to let her leave. We can't keep her in here if she's fine. They checked my vitals. Everything said I was good. So I get home, same day that they discharged me. I lay back to go to sleep and felt like 10 people were sitting on my chest. I was suffocating. So I didn't understand. I sat up. I was so exhausted. I sat up and I heard a gurgle. And I said, it feels like there's water in my chest. I tell my mother and my husband. So my mom comes in and she sits next to me. She's like, baby, I'm going to watch you. Just lay back. I laid back to go to sleep again. Next thing I know, my husband is shaking me because they said they could actually hear what sounded like I was drowning in my sleep and they could not wake me up. So I was so exhausted, so tired, completely depleted, but could not know what to do. I just didn't know. I had my baby here. And so my husband gets on the phone to my doctor. He tells her what's going on. She said, rush her now to the hospital. So I get back to the hospital. They admit me right away. They believe that I had what's called, or at least what they said it was, fluid overload, to where the fluid had gotten into my lungs. I had edema by this point in my legs, my thighs. It had traveled all the way up to my lungs. So literally when it sounded like I was drowning in my sleep, I really was. I was drowning in fluid that was in my lungs. This was the same day I was just discharged from the hospital. There's so much more to this story, but I really want to be able to roll this out, this conversation, this safe place for us to share, and then really examine the why. Why is there such a disparity? This is alarming, but we got to have these tough conversations first. And so I'd like to welcome, number one, Dr. Angela Marshall. She is a primary care physician and founder of a women's health practice in Maryland. Hello and welcome to the conversation.
Hello, thank you for having me. I'm happy to be here, although not happy to be talking about this topic.
Yeah. I also want to bring on Lauren Nunnally, who's a perinatal nurse and midwife, so special, who's now serving as the chair of the Association for Women's Health and Neonatal Nurses. AWON, am I saying that correctly?
That's right.
Okay.
Yeah, right.
2020 Public Policy Committee. She is on it, and thank you for joining us.
Thank you for allowing me to be here.
Kanika Harris is also going to step into the room. Behavioral health scientist she is, a doula and birth justice advocate. Love that. Currently serving as the public health expert on the Mayor of DC's Lactation Commission. Hello to you.
Hello. It's a pleasure being here. Thank you.
Thank you. Emily Price, are you there?
I am.
Hello. She's the executive director of Healthy Birthday Inc. and oversees the national expansion of the Count the Kicks public health campaign that encourages expectant mothers to track the baby's movement during the third trimester. I did that. Thank you.
Good. Thank you. Happy anniversary to Black Women's Health Imperative. Thank you for having me.
Okay. Well, I have questions for each of you, and then for those of you who are joining us, we're going to open the room for your questions as well. But before we kind of segment this off, I really just want to get you all, because you just heard my personal story, and I'm trying to understand that disparity, the reason why. Why is there such a huge difference between Black deaths and white deaths in childbirth?
Well, Egypt, thank you for bringing this conversation to the forefront. It's a shame that we even have to have this conversation in the developed world. But the reality is that, yes, Black women are dying at alarming rates when compared to white women. And let's not forget that our infants are also dying at alarming rates. Our infant mortality is 2.5 to 3 times that of white children as well. And the crucial issue at hand is that in the developed world, Black women should not have to risk our lives simply to have a child. This should not be the case. And so I think there are many factors that come into play. There's research that has found that there are several things, but one of the top ones that consistently comes up is stress. And we're talking about stress from systemic racism. We're talking about stress from things like unequal pay for equal work. We're talking about stress from social determinants of health, things like housing insecurity, food insecurity, the daily microaggressions that we all go through, seeing our men and women get brutally murdered on the news on a regular basis. I could go on and on and on, but there's so much stress that Black women are being subjected to in this country. And we know that stress negatively affects our health in a great way. And on top of the regular stress that we undergo, going into the healthcare setting is also stressful. And the reality is there are a lot of healthcare providers who simply don't treat us well. You know, we talk about things like implicit bias, right? And, you know, we like to use the word implicit because we want to believe that it's unconscious or that it's unintentional. But when it keeps on happening, it makes you wonder, is it really that unintentional? So we really have to do more to shine light on this problem because it is traumatizing our entire community.
You make some very good points. You just kind of went there with it. And I'm so glad that you just ripped the Band-Aid off of, you know, what I think many of us were thinking is that Black women are under an enormous amount of stress to carry the family unit, to maintain our careers, to maintain, you know, a quality of life as well. And then there is so much truth in what you just said as far as how we are treated by our doctors. And, you know, even like I said, even I experienced it where you would complain that something just doesn't feel right. You know your body. There is, and I've read several articles on this where other Black women say that they feel dismissed by their doctors and that there's a thought that Black women complain more, that we just kind of whine and complain and run to the doctor for everything. And so, you know, they're not as liable to believe us when we say that something actually is going wrong with our body.
Well, you know, you're absolutely right, Egypt. And, you know, I went into medicine because I wanted to help people, but I almost didn't make it out because during my last year of medical school, I had a child that I lost in medical school in a healthcare setting because the doctor did not listen to me. The doctor did not pay attention to my child. And the bad part about it, it's bad enough to miss something, but when someone is telling you that something is wrong and you still don't listen, that is a problem. That's the same thing that happened with Serena Williams. She tried to tell them, look, I've had a blood clot before. This is probably what's going on again. I need treatment right away. And so when they don't listen to us, it really begs the question, you know, why are you here? Are you here to help me or not? And it also draws parallels, I think, to the police brutality issue that we're having. In the example of George Floyd, you know, Officer Chauvin had his knee on his neck. There were all kinds of bystanders standing around saying, hey, what are you doing? He can't breathe. Even George Floyd said, I can't breathe. And what did he do? He did nothing. And so Black women are now saying, we can't breathe and we need our healthcare providers to pay attention because we are dying unnecessarily.
And as I said, in my own personal hell that I was going through for several days, I actually said those words, I can't breathe, I'm drowning. I felt like I was drowning. And no one would listen to me. This is what they actually, you know, it makes me so angry, but you know, they actually said to me, your body is absorbing more fluid than the average person. I went in healthy. I came out. Now I have issues that I have to deal with for the rest of my life. You know, that every day I struggle and have to be on medication because of my experience after childbirth and them ignoring what I was saying and actually letting me out of the hospital, telling me I had to go. And I'm saying, I don't care. I'll pay for it. I need to stay here. And I was right. That same day I had to come and be rushed right back. And so imagine the women who didn't live to tell their story.
Right.
You know,
Right.
the children who needlessly died because, you know, people just didn't pay attention to the warning signs. And that's what we're trying to bring light to today. And so you have outlined, Dr. Angela, so many important factors that are contributing to this pandemic.
Yes.
We're in more than one pandemic.
It is a pandemic.
It is. So what can we, knowing these factors exist, what can we as Black women do to, you know, further advocate for our own health? I have a niece who's 23 years old. She's about to have her first baby. She may be on this right now. And so what would you tell her?
Well, first and foremost, we all have to work to change the system, right? But in the meantime, I think it's important for all of us to work on our own stress, right? We all have personal stress. And so while we work together for social justice, we should work on ourselves, doing things like practicing self-care, getting regular sleep, regular exercise, taking time for yourself, and also making it a priority to try to optimize your health. Because when you optimize your health, then when unexpected things come your way, like global pandemics, COVID-19, if your health is optimized, then you're less affected by surprises or by unexpected illnesses. I also encourage everyone to assess your stress level. Now, the Black Women's Health Imperative has a stress test that you can download on our website. It's at stresstest.bwhi.org. Because sometimes
every Black women's meter is going to go off.
It's going to go off the charts, right?
Your stress.
I don't need a test to tell me that, but I say that because as Black women, sometimes, you know, we're strong, you know, we sweep things under the rug, you know, things happen to us, we're resilient, we are strong, you know, but sometimes we don't realize how much stress we're under. And so I think it's important to, first of all, get in touch with our stress level and make sure that we're doing something about it. Consider things like therapy. I think every person in this country warrants therapy just from being here with all the racism that we have to deal with. Mm-hmm. So I think addressing our stress.
Therapy is a whole word, and it's not a bad word. You know, it's something really to be said for the mental health industry that I think, you know, people kind of shoo it away, and it's the thing you don't talk about, but it should be just as normal as it is for a woman to go to a gynecologist. We should be able to go to a therapist.
That's right. And I think it's also important to have a health advocate, right? You mentioned your mom was with you, which is great. It's so important to have somebody there, because when you're vulnerable, when you're in a situation where you're sick or in the hospital, you may not be able to advocate for yourself. I have a good dear friend of mine who almost died had it not been for her husband at her bedside. She was hemorrhaging to death. She was too weak to say anything. And thankfully, her husband saw that she was bleeding. And so we need our men, we need our partners, our family, our community. We need advocates. We need people to be there by our side in the hospital. We need people to be able to stand up for us and say, hey, she's in pain. Aren't you going to do something about this? And know who to call when they're not doing what they're supposed to do. And we all know that in the healthcare system, people do tend to treat you a little bit better when you've got somebody there watching. And so we want to make sure that we've always got an advocate there for us to make sure that they're doing what they're supposed to do for us.
And how do we do that in the COVID age where, you know, they're not letting anyone else in the hospital?
That's right. So I've been telling my patients.
So many people, you know, and we're going to call them COVID babies, because being shut in for so many months, I mean, there's so many babies on the way. So, yes. But how do we do that moving forward in this new normal, if you will?
Yes, I've been recommending to my patients to use their digital technologies, take their cell phones, FaceTime. I have some of my own patients that I tell them, FaceTime me or call me when the doctor comes in, because I want to hear what the doctor is saying. So you can do the same thing with a loved one. call them or FaceTime them every time somebody comes in, so that and you can say, hey, you have any questions for the doctor?
Right.
But I think it's important to use what we have right now. You're right, with COVID-19 is it's adding a whole level of stress on top of everything, because now you've got to be in the hospital by yourself. But we can use the technology to help us out.
We appreciate you so much. Thank you, Dr. Angela.
Thank you.
People like you are going to help us heal the system. I want to bring in Lauren Nunnally and Kanika Harris as well. So ladies, you are both, well, you're a doula and you're a midwife. And I don't think a lot of women really understand, unless they've used a midwife or a doula, don't really understand what that entails. So before we kind of get into the conversation, can you explain where you come in the childbirth process?
So midwives are used as full spectrum care for pregnancy, childbirth, and delivery. If it's a low risk pregnancy, there are a lot of hospitals, a lot of states that have midwives that will provide continued care, and the women very rarely have to see an obstetrician unless there is complication. So midwives do provide full spectrum care for pregnancy, taking care of the delivery, and following women postpartum as well.
Mm-hmm.
Yes, and as a doula, which is not a midwife, a lot of people confuse doulas and midwives. Doulas provide non-clinical care for women. There are full spectrum doulas that work from prenatal care to birthing to postpartum care. Even if you have an infant death, they will support you for that infant death. And doulas, like Egypt, you mentioned, your mom was your doula. You know, doulas.
Not really.
Huh?
My mom was the whip cracker. She wasn't there through the process, but she was there when I needed her the day of.
Right. And so doulas, you know, they help you with your birth plan. You know, we definitely recommend that all women do have birth plans. Birth plans are documents that you write and you prepare with your birth team and your family. I always recommend my clients to keep their birth plan to one page, because you never know when you walk into the hospital or for your birth, if that's the first time a provider is going to see that document. And I ask them to think about what their ideal birth is, what happens if there are some complications, what do they want to keep about that birth plan. And for instance, in your case, Egypt, and I had 2 horrible pregnancy complication experiences, but what happens if it all goes out the window and you end up having a cesarean? What do you want to keep? So we talked through those birth plans, and sorry, there's little ones.
How many children do you have?
I have 2-year-old twins and a boy and a girl that
The
just
best of both worlds. Okay.
sorry.
And I have a doula with you. I know you are a doula, but does a doula have a doula?
A doula has a doula, absolutely. My doula, rest in peace, was Collier Booker. She was well known in the DC area for her work. And she was also a lawyer and a judge. So I made sure that I had all that in place for my pregnancy because of my complications. A doula absolutely needs a doula. I've been a doula to OB doctors. I've been a doula to midwives. One of my best friends, she's a midwife, and she had a birth last year, and I was at her birth supporting her. So everyone needs a doula, absolutely.
Does the mortality rate go down from your experience and from what you know? Does it go down when women have birthing plans and they have doulas or midwives?
That is an interesting question. I think we need more research to really on that, but I think that you find that women definitely have more positive birth experiences when they have a doula and when they have a plan in place. They definitely have a more positive birth experience. But we are working on the data and we are working on the research to show that when you do have doulas and you do have support, that you do have better outcomes overall. Absolutely.
And
I would just add that one of the key factors is the support, the continued support. A lot of research does actually show that continuity of care, continuity of carer actually helps to decrease instances of morbidity. So it helps with building trust, building confidence. And of course, it makes it a little bit safer for patients to know that they've got somebody who they trust and who will be there to support them. That's the idea. That's the hope.
Yeah.
There are a lot of instances where midwives and doula do work very closely together and they have successful outcomes. Unfortunately, there are also situations where there are some strife between midwives and doulas, and a lot of that falls down to a lack of understanding. Sometimes it's a power play. Sometimes it's just that there isn't a relationship there, and that's unfortunate. And unfortunately also, a lot of the time that's what gets highlighted. And so it does appear, and I'm sure my colleague would agree with me, that midwives and doulas don't work well together, or doulas don't work well with obstetric nurses or obstetricians, and that I would disagree that happens less than it does in reality.
Yeah, I would say that doulas provide critical care when we're talking about these gaps in care that women are receiving, especially when you're talking about low-income, vulnerable populations. Doulas and community doula organizations when you're dealing with hospitals that are understaffed and are under-resourced, these doulas provide very important care and gaps that we're seeing. Really working to save lives, really working to push that button to say, hey, there's an emergency happening in this room, and you've left this woman for hours and hours and hours.
Yeah.
You know, driving clients to hospitals that may not have transportation. So I think when you are looking at those critical gaps in care, doulas and midwives are absolutely saving lives. And with what Lauren said, I would add that fundamentally, if you don't feel safe in a birth, any living creature, if you don't feel safe in a birth, if you're a dog, if you're a cow, if you're a human being, then you're more likely to experience complications. And that continuum of care, like Lauren mentioned, having doulas, having additional support, having someone advocate for you is critical in feeling safe. And I would say if you have a birth plan and you're going over that birth plan with your provider and they don't agree, or you guys aren't on the same page about it, find another provider, find another hospital if you can. Because the most important part of this is that you feel safe going into your labor and delivery.
Thank you for saying that, because I believe that a lot of women, especially, some of the younger women going through pregnancy, don't necessarily think I have a choice. After all, whether you have health insurance or you don't, you always have a choice. Your body is your body. Your health is your health. It is your right that if you feel uncomfortable in someone's hands, or you don't feel you're getting the level of treatment you need, you switch. You find someone who is going to take you and your health personally. And so thank you for saying that. But if I'm watching this, for those who have joined us, I have a lot of questions. So here they go, ladies. The first is, does health insurance pay for a doula or a midwife?
Not in every state. There's been a lot of lobbying, legislative lobbying for that, because as Dr. Kanika said, that there is evidence to show that there are better outcomes when women are supported by a doula. And the reality is that the busyness of hospitals, labor and delivery units, that nurses cannot stay with a woman throughout the duration of her pregnancy just because of other demands. It's not because they don't want to. So I know in some states that is something that has been successfully gone through Congress, but not in the state that I work in. I'm not sure with my colleague what happens in her state.
So then the other question is because you did mention, Kanika, you mentioned about lower income. And so, the question is, where are the resources, and are there programs for women when they get pregnant to support so that they can have incredible women like you by their side, and they can feel that they have an advocate, someone looking over their shoulder to make sure that they're, that they're in good hands? Where are these resources so that they can find a doula, and are there programs that would help them pay for it? Do you know? If you do, please share.
Sure. So I would say nationally, it's going to vary. But one place to start definitely is looking at your community doula organizations in your state. DONA, which is the nationally certified doula program that's offered nationally. A lot of times what I tell my clients when they can't afford doulas, check the DONA website, DONA. And a lot of times they will have volunteer doulas or doulas that are working on getting their certificate that will work with you for free.
That's
to
a great idea.
that support. But I would say nationally, state by state, check your community-based organizations, birthing organizations in that state for resources and support. I know in Washington, D.C., a big organization that we use that is monumental in our work is Mama Toto Village, and they provide resources for women. And they provide a full spectrum of care for women. And if you can't afford it, they will help. And I know I am starting to work on the advisory board of Birth Detroit. I started my work in Detroit as a doula, and they're working on developing their first freestanding birth center. So there's probably different organizations in each state that you can reach out to look at.
And Lauren, I know when we first brought you in, we announced AWAN, but BWHI has actually just announced a partnership with AWAN. And for those of you who are just joining us, that stands for the Association for Women's Health and Neonatal Nurses. So tell us about this partnership and what's going to come of it, what fruits?
Right. So AWAN, the Association of Women's Health, Obstetric and Neonatal Nurses, it's quite a long title, so we shorten it to AWAN, actually provides membership for 350,000 practitioners who work in the space of obstetrics and neonatal health. And they have been working in partnership with the BWHI and also the National Birth Equity Collaborative to look at how they can work on supporting the practitioners that provide care for pregnant women, newly delivered women and newborns, to make sure that's a little bit more equitable. We know from statistics, as you mentioned earlier, and Dr. Marshall also mentioned, that Black women are at increased risk of dying, and that's through a number of factors, primarily stressors, systemic racism, unequal access to care, and many other disparities. So what the partnership that has been and there's been a press release that has come out today to announce that. So AWAN and BWHI are going to be working on some training that is going to be provided to hospitals, to nurses, and other health practitioners to ensure that they are aware of implicit biases, that they're aware of checking their own biases and what they can do. It's a comprehensive training that will provide them with knowledge and education, again, supported by the National Birth Equity Collaborative, to ensure that the care that is given is equitable. Often, nurses and health providers will say that they provide great care. I treat everybody the same. And that is generally a sweeping statement that often comes from good intent. But what it really says in whole is that you can't treat everybody the same, because not everybody starts from the same level playing field. So
you do me a favor and say that again, because the connection got a little bad, and I want to make sure everyone heard that. You were saying what it really means is.
So yeah, saying that you treat everybody the same is not really fundamentally what it is. Not everybody starts from the same level playing field. So if you treat everybody the same, then you're going to provide the same level of care. You're not going to consider those that are marginalized, have disparities, have disabilities, maybe don't speak English as their first language, or even take the time to understand what it is that is preventing them, because a lot of these are external factors that sometimes are outside of the control of these women. So that's where equity comes into play as opposed to equality.
Thank you so much for that. Guys, we're going to be opening up for questions in a few. And so whatever's on your mind, make sure that you're writing your comments down in the chat. We'll make sure we get to them. I am going to bring Emily on in a minute as well. But here is where I'd like to wrap up with you guys for a few. Can you speak about policies that are in play not in play or should be in play
Right.
as it pertains to Black women in childbirth?
Sure. So in terms of policies, I would just want to say I'm so proud of Black women. We are kicking butt on the front lines, working every okay. We want to make sure that we do not lose one more Black mother or baby, Black or brown, I should say.
Not one more.
One bill, HR 6142, Black Maternal Health Momnibus Act of 2020, This is led by Congresswoman Underwood. She is the youngest Congresswoman, I think, in history, Black woman, and Congresswoman Adams. It's an extremely comprehensive legislation addressing social determinants of health, which deals with where we live, work, and play, such as nutrition, transportation, and childcare, paid leave, mental health. It has many provisions, such as extending Medicaid coverage for postpartum care from 60 days to a full year, which is a no-brainer. If maternal mortality and infant mortality is death within that first year, then why is our postpartum coverage only 60 days?
Yeah.
Just this Monday, Congresswoman Underwood and Adams hosted the Black Maternal Health Caucus Summit, and they reported that just last month, the House of Representatives passed the Patient Protection and Affordable Care Act Enhancement Act, which includes these provisions of extending postpartum coverage for 1 year. So it's an amazing start. And this bill was really created in partnership with the Black Maternal Health Caucus that is really working to center the voices of Black women, Black mothers, politicians, scientists, community activists that are really at the intersection of addressing this problem and making sure that we dismantle racism for Black and brown birthing families. I would say that Medicaid is an important part of this, but we also need to have this coverage for all women, no matter what your insurance is, private or Medicaid. And we also know that now during COVID, we need to address these issues about what's going to happen with this vaccine. Is it going to be safe for pregnant mothers? We need to know the impact on this vaccine for mothers of color. So that's something, those are policies that are just on the forefront that we need to push forward immediately.
And there needs to be an entirely different one on conversation on vaccines, because there's so many questions about it already, and the vaccine has taken a ride. But ladies, thank you. Can let me ask you something? Can you stick around for a minute, because we have some questions for you? But I would really like to right now bring on Emily Price, and she is the executive director of Healthy Birthday, Count the Kicks app. Emily, are you there? Emily, thank you. Emily, why is it important to count the kicks?
Well, Count the Kicks is vitally important, especially for high-risk moms, because research shows a change in your baby's movements is often the earliest and sometimes the only indication that there might be an issue with that pregnancy. And so just like adults, when we don't feel well, we move less. Babies are the same way. If their movement changes, moms need to speak up. It's like a vital sign, if you will, that moms need to speak up and tell their provider. So we have a free app that's available to moms in app stores, and it allows them to have a daily kick counting session where they can pay attention to their movement, baby's movements once a day, get to know what's normal for their baby, and speak up if they need to change.
When I was pregnant with Kendall, she's my 8-year-old. She never moved. I didn't feel her move at all, and I thought that was so abnormal. And they were saying, she's moving. I said, but I'm not feeling it. Then when I was pregnant with Harper, she moved all the time. She's still moving. She has never stopped moving. She's 18 months old. But I noticed second trimester, she was super busy. I mean, she was here and there. I thought she was doing jumping jacks in my stomach. But by third trimester, I got really, along with the gestational diabetes, I was alarmed about everything, right? And third trimester, I almost felt like I could maybe feel her move just a few times in a week, not even just a day. So I didn't even know we were supposed to count the kicks. No one told me to count the kicks. And that, again, it lends back to why we're having this conversation, right? Women are not being necessarily told everything, Black women, to prepare ourselves. For all I know, with this Count the Kicks app, for all I know, I totally missed the mark with her. Thank God she's here and she's healthy. How is your app being received by Black women?
We've had a great response. Black women are saving their babies with the Kicks app. We have a local woman here, Dana Morrison, who was using the app. She paid attention. She got to know what was normal for her daughter. And she spoke up when she noticed a change. And luckily, her provider took her seriously, investigated, ran all the tests, the biophysical profile, the ultrasound, figured out that her baby was in real distress, and got that baby here safely by emergency C-section. And so Dana is the hero of her own story because she was paying attention and spoke up.
So what were the signs for her?
For her, her baby's movements had slowed significantly. So your baby doesn't even necessarily have to stop moving for it to be alarming. The baby can gradually, their movements can gradually decrease, or research also shows a rapid increase in your baby's movements is also an indication that you should call your provider and speak up if you notice a change. And here in Iowa, where Count the Kicks originally began about 12 years ago, we're a nonprofit organization founded out of loss, 5 women who all lost daughters to stillbirth and infant death. When we started here about a decade ago, 12 years ago, we helped reduce Iowa's stillbirth rate by 32% in the time that Count the Kicks has been here, working with the Department of Public Health. But I should tell you that in the first 5 years of Count the Kicks in Iowa, the stillbirth rate among Black women reduced by almost 39%. So it is being received well here. It's the only place that has seen that significant of a change in the stillbirth rate. And when we say stillbirth, that's a baby that is still between the weeks of 20 weeks and greater. And so we know that the health of the baby and the health of a mom are intrinsically linked. And so we're talking about maternal mortality. And we believe that, as you said, tracking fetal movement helps monitor the health of the baby, but also can help monitor the health of the mom.
I mean, almost 40%. How do we get the word out even more? I mean, if you have made such an impact there, how do we get this out on an international level, not just national? Because to me, everyone needs to know about this app. Like I said, I'm grateful that my child is healthy, but that's scary, isn't it? Third trimester, to feel like I can't even feel the baby move anymore. And the doctor would tell me, Emily, the doctor would say, it's because it's getting really tight in there. She's growing, she's big. She doesn't have as much room to move around. And I'm like, But then I thought about Kendall, my 8-year-old, and how I really, during the whole pregnancy, didn't feel her. So I thought maybe she's right. It's just me. But again, when you're saving lives like this, we've got to be able to get this word out. What are you guys doing to reach more people right now?
Well, partnering with Black Women's Health Imperative has been significant. And so forming partnerships like this, working with AWAN, working with AmChimp, trying to work with the CDC and members of Congress to be written into these bills that are so important. The app has been downloaded 110,000 times. We have partnerships with health departments in 10 states, but we're working every day to get partnerships in all 50 states because the importance of fetal movement has been around for decades. Obstetricians, doctors have known this is important, but we are the only organization, and we're only 10, 12 years old. We're the only organization that focuses solely on this. And we're a small nonprofit, really trying to bring this to every mom. There are 4 emergencies in this country every single year that we need to reach. We lose 1 out of every 94 pregnancies ends in stillbirth, and that's completely unacceptable. That 1 in 94 Black pregnancies would end in stillbirth, and so we're just working hard every day. And so being on a platform like this is critical to getting us to reach all 4 million of those pregnant moms every single year in the U.S. So thank you for helping us raise awareness. And we would love your help beyond today as well.
Thank you, Emily. Count the Kicks. Get the word out, everybody, please. I want to bring everyone back on. Please, answer some of these questions that have been coming in. Wow, and just open up for any additional commentary. Thank you, ladies, for hanging out and for rejoining us here. So I know I saw a question come in earlier from Jessica, who said, are doulas and midwives even allowed to be with patients now during the COVID pandemic? What has been your experience over the past 5 months?
Well, in the beginning of the pandemic, my experience has been that you couldn't have any support person with you. For the first time, we were seeing moms, horrible for Black and brown moms that are delivering babies alone with no patient advocate. Now I'm seeing that you can have one support person with you, and they must stay with you the entire time. And I don't know how it ranges nationally or from state to state, but I think that's kind of the general idea. So if you want a doula, then you have to choose between a doula and maybe a husband or another partner.
Wow. And so, Dr. Angela, you and I were talking at the very beginning of this entire conversation, and so now you've also heard from all these other ladies. What would you like to add to this conversation? You're a wealth of information.
I'd like to encourage all of our listeners to support the Black Women's Health Imperative. We're a national nonprofit, and the ladies working at the Imperative are working every day to help reduce maternal mortality. They're working on policies and legislation. They're developing programs for women. And, you know, little do you know the effort that goes into some of these things. They're helping us and helping you in ways that you may not even be aware of. And so support the Imperative, engage with us, follow us on social media, and even donate if you can, because it's such an important organization.
You know, we talked a bit earlier about not feeling that we were listened to. You know, when we go in, we complain to our doctors and tell them that something's just not right. And so if you feel that you're falling on deaf ears, how can you elevate an issue in a clinical setting where you feel that the doctor's simply not listening to you? What are the steps you need to take?
Well, first of all, you can fire your doctor and ask for someone else. That's number one. If a doctor is not listening to you, it's time to find another doctor. Number two, if you find yourself in a hospital setting, you can always ask for the CEO, or you can ask for the triage nurse or the head attending in the hospital that you're in. But I think the most important thing is, do not let yourself be dismissed. Just because they try to dismiss you, don't take it. Stand up, use your voice, jump up and down, wave your arms if you have to, because it could, in fact, mean the difference between life and death. So it's so important that we use our voices and fight for ourselves and fight for each other.
And you know, Lauren and Kanika, what else can we do to realistically change this provider bias, this racism, this systemic plague that, you know, exists not only in healthcare, but just across society, as we're seeing with all the protests and march and what have you. But how can we change this from the inside out, since it's creating these negative health outcomes? What else do we need to do? Because apparently people are shouting from the streets right now and still being listened to.
Yeah. I mean, that's a huge task. It's a heavy lift, and it's systemic. It's been happening for centuries, so it's not going to change overnight. One thing that I think is happening there is a lot of grassroots work happening across the country. A lot of organizations, and there are more uprisings of organizations that are making a stand and calling to action for change. And I think a lot of these organizations that advocate for women, that have the voices and the ears of women, are stronger when they have collaborations with the hospital environments, with physicians, with nurses, with midwives. One of the things that A1 does advocate for is building partnerships with community organizations. And I think that for women, I think, as Dr. Kanika said earlier, having someone advocate, like you had, Egypt, you had your mother advocating for you, you had your father your husband advocating for you. Like Dr. Marshall said, it's really important to not feel dismissed. That can be really difficult sometimes, because one thing women are concerned about is that if they speak up and if they, make waves, that they may not get good care, that they may not be listened to even more, and to their detriment. So I agree with her that sometimes you have to take the chain of command. A lot of facilities have patient care advocates. They have ethical organizations within the hospital that will speak for the patient. But I think most importantly is having someone there to advocate for you, because again, when you're in that environment, you are often the most vulnerable, and you may not feel that you can speak up for yourself. So having someone else do that is very helpful.
Yes.
I would add that, this is, as Lauren mentioned, this is systemic. And it's systemic even in funding that's provided for Black researchers, funding that's provided for Black women's health imperative, funding that's provided for these community-based organizations around the country, that are led by Black women. And from a policy perspective, if you're centering our voices, we've been saving ourselves for a very long time. We know what to do. If we are funded and you give us the money and there's partnerships with us, we were leading the work instead of being a part or adjunct to someone else's team or a consultant for someone else. We need to be in the lead. We need to be in the front, leading these initiatives. And that's just, again, a part of systemic racism. I would also add that there's an app that's developing called the Earth app. It's IRTH app. It's drop the B for bias. And this app is supposed to be in the hands of every woman. So when you're in these hospitals, you can report your bias, you can report your experiences, and hopefully they will be able to collect, led by Kimberly Aller-Seals, will be able to collect information on each hospital, give them a grade and say, hey, you don't want to go to this doctor. Hey, you don't want to see this provider because they got an F or they got a B. Right? So these are just different ways that Black women are really trying to attack this issue from a systemic perspective and work on that bias and that racism. I don't think we personally can. Uh-oh.
Say that again. What is the app that you said is supposed to be in everyone's hand?
It's Earth, IRTH, the Earth app. You would have to Google it, look it up. I'm not sure exactly where it is in development, but it's developed by Kimberly Aller-Seals. I know they got funding from the Kellogg Foundation. It's definitely worth looking up. And hopefully this app will be in our hands and we'll be able to have the power to say, this is what's going on at every hospital nationally.
Okay, so I want to just shout out a few people who've been joining us and watching along. New York says that's a big problem in the UK. No OBGYN doctors and hospitals are currently being fully audited, so women can't see their performance statistics. So it's Russian roulette, whatever the doctor's race. Melanie says, are there any efforts being made towards allyship with obstetric anesthesiologists specifically, not just OBGYNs? I'm going to throw some more questions out and then you guys can do a free for all, okay? Karen says, we're so grateful for this information. Everyone's just saying earth, that. Okay. Let's see. Are there any issues of racism based on color of advocate as well? Thank you, Amanda, for that question. And a lot of people are just saying, great job. This is really important. So go ahead, ladies, discuss.
I want to just jump in and say that we need implicit bias training for all healthcare providers. It needs to start in the medical schools and understand that there's not just bias about race and ethnicity. There's also bias around conditions, like people who have mental illness or people who have things like chronic pain. They experience just as much bias, if not more, than we do just based on our race. And as women, we have this intersectionality that happens. We've got gender, race, and other factors. If there's socioeconomic, that's another factor. Sometimes there's obesity bias. And so there are many factors that people exhibit bias around. So I think it's important to be aware of all of them. And the healthcare community really needs training on this.
I agree.
Yeah, and I think the bias training has to be accompanied with systematic change. And I think we need more stringent, we need to be more hard on health professionals. I will say that I will say up and down that I have experienced health professionals, nurses that have saved my life, that have spoken up for me and said, hey, she's bleeding out. What are you doing? She needs the help. And so I would say that there are definitely good nurses, good doctors out here, but for the ones that are killing us, they need consequences similar to police brutality, similar to other. We need hard consequences. I think that's the only way to really get some true change.
I agree. I think that it's not enough to say we've done cultural competence, we've done implicit bias training like it's a checkbox. It has to be intentional. And I think that there are a lot of places that have good intention, but it's got to be more than that. It's got to be embedded into policies. It's got to be embedded into the structure, into the culture of the organization, and maybe even into competency and annual reviews. And that way, I think that there will be some sustained change.
Ladies, thank you all for being here and for just pouring into us. You really are saving lives with your time, with this information, your investment here. Dr. Angela Marshall, Lauren Nunnally, Kanika Harris, Emily Price. I just want to refer to, as we wrap up here, I want to refer to one of the comments we got earlier during this session from Vanessa Mishkit. And she said, never doubt that a small group of thoughtful, committed citizens can change the world, because indeed, it's the only thing that ever has. From Margaret Mead. Thank you, Vanessa, for that. And you're so right that, sometimes we feel alone in this fight. We feel alone in our own health struggles and endeavors. We feel alone in the system. Yes, we can attempt to attack this systemic racism. We can attempt to attack this alone, but my goodness, how much farther we get together. And so we got to continue to be warriors. We got to continue to be soul survivors. We've got to continue to be advocates for our own health, but also our sisters' health, and continue to have conversations like this. And that is why Black Women's Health Imperative is so important for bringing this to the forefront and giving us this opportunity. Thank you. It is their 38th anniversary. And so many more amazing panels to come. I want you to go to bwhi.org to get more information, and just thank you for the opportunity to take part. It has been my honor. I'm Egypt Sherrod. Thank you.
Thank you. Thank you.
Thank you.